Welcome to the Hawaii Health Data Warehouse Coffee Break Monthly Webinar Series. I'm Tanya Lowry St. John with the Hawaii Health Data Warehouse, or HHDW, in the Office of Public Health Studies at the University of Hawaii at Manoa. We're going to use the next 30 minutes to introduce you to fetal death and induced termination of pregnancy, or ITOPs data in Hawaii, including how they're defined, where to find them, and how to use them. Vital statistics records in Hawaii are managed by the Office of Health Status Monitoring in the Hawaii State Department of Health. Vital statistics include, but are not limited to, official records of births and deaths, fetal deaths, and induced terminations of pregnancy, or ITOPs. In Hawaii, state law requires a fetal death certificate to be issued for every spontaneous uterine death of a fetus at any time during the pregnancy. So please note that this is actually different from the national reporting requirement, which is only for spontaneous deaths to a fetus at 20 or more weeks of gestation. The fetal death certificate contains important information about the woman and the fetus, including information on maternal risk factors and congenital abnormalities of the fetus. HHDW has fetal death data from 2000 to 2022, and we have reports from 2012 to 2022. Since this information is shared with the National Center for Health Statistics, fetal death information for 20 plus weeks of gestation is also available through the CDC Wonder. To find fetal death data in HHDW, start by navigating to the data sources and select death data. In the death data page, you're going to scroll down to the special topics area, and you'll click on the information about fetal death, and this will bring you to the fetal death data page. Here you're going to find some basic information about the fetal death data and also a table with the number of fetal deaths per year since 2000. So with fetal death data, please note that the most recent year of data is considered to be provisional and may be subject to revision in the following year. However, I will say that the numbers have remained pretty stable over the last couple of years. When you scroll down on this page, you're going to see our standard report request and record level request buttons. For report request, this is when you're looking at the reports that we have, if you'd like additional information you'd like us to run for you, then you would click report request. We have a limited ability to do some of those. And if you're interested in trying to secure this data to do your own analysis, you would do a record level data request, and that would be clicking on this button. There's a coffee break that explains our record level data request procedure. Scrolling down further, you're going to see the links to the CDC National Vital Statistics System, as well as the CDC Wonder for fetal deaths information. And again, remembering those are only going to be for fetal deaths of 20 plus weeks of gestation, and then also links to the Hawaii State Department of Health Vital Statistics System. So scrolling back up here, you'll come to our fetal death reports drop-down menu, and you can see that at the present we have one fetal death report. So you can click on this, and this brings you to a PDF file, in which case in the first page we have definitions. So one thing to know when you're looking at fetal death rates are calculated per 1,000 live births for Hawaii residents. Other things to note on the page will be for privacy, cells within 1 to 9 are suppressed, and for statistical stability, rates are not calculated for cells with fewer than 20 deaths. Also, if you'd like to cite this work, we have a suggested citation for you here. Scrolling down, you can see that the fetal death report is going to contain by year the fetal death count and rate for state and county. So you can see here, for example, in 2021, there were 451 fetal death certificates filed in the state of Hawaii, and divided by the number of live births times 1,000, that's 28.1 fetal deaths per 1,000 live births. You can see also in here that when you see NR, that data has been suppressed, so it is not reportable. And then here you can see that underneath each table will let you know what data is missing from the different fields, either from the birth or from the fetal death record. So you can see that there is some data missing throughout the report. So then scrolling down on the next page, you will see the fetal death count and rate by mother's age. So again, you can see very few among the 18-year-olds, so most of that data is suppressed here. Followed then by mother's DOH race ethnicity, and then by physician estimated gestational age. So now let's take a look at ITOPs data. ITOPs is an acronym that stands for Induced Terminations of Pregnancy, which are also referred to as abortions. A legal induced abortion is defined by the CDC as an intervention performed by a licensed clinician, for instance, a physician, a nurse midwife, a nurse practitioner, or physician assistant, within the limits of state regulations that is intended to terminate a suspected or known ongoing intrauterine pregnancy, and that does not result in a live birth. So please note note that this definition excludes procedures that are done for the management of intrauterine fetal death. It excludes early pregnancy failure and loss, ectopic pregnancy, or retained products of conception. So those are going to be important to know the definition of that. So the ITOPs data captures information about the woman, the procedure, whether it was done medically, so via medicine or surgically, and information about the fetus. The information is captured by the Hawaii State Department of Health Office of Health Status Monitoring and voluntarily shared with the CDC abortion surveillance system, and I'll show you the link to that in a moment. HHGW has data from 2000 to 2022 and reports from 2012 through 2022. So to find the ITOPs data, we can come back to the death data page. And again, to navigate to there, you go into data sources, death data, come back down to our special topics section, and we're going to go into the ITOPs page here. And again, at the beginning, you'll find some basic information about ITOPs. You will find a chart that says the number of ITOPs per year since 2000. And one thing to note that this is all of the ITOPs that occurred here in the state, so not necessarily to residents. When we get to residents, you'll see that the numbers might be slightly different. Our reports are based on residents. And that also to note that the ITOPs data is not always complete due to its sensitive nature. So scrolling down on this page, you're again going to come back to that report request and record level request buttons. And then for here, we have links to the CDC abortion surveillance system, as well as DOH vital statistics page. So scrolling back up, we're going to come to the drop-down menu for ITOPs data and reports. And again, here we have one report at the moment, but if you've got ones that you really like, we can always look at try to automating more. And we can click on this report. And we can see that, again, we'll have that cover page with that background information. And again, ITOPs, like with fetal death, the rates are calculated per 1,000 live births, and we'll talk about this in a minute. And it goes back to the same thing with our cells. For reasons of privacy, data is suppressed when the cell counts are between 1 and 9, and for statistical stability, no rates are calculated when the counts are less than 20. And again, here's a suggested citation for this report. So scrolling down here, you can see that we have the data by state and county. So here in 2022, you can see that there was 1,113 ITOPs in Hawaii. So our rate per 1,000 live births would be 123.5. And then scrolling down, you can see that then we would have that data as well for by age, and then again by race ethnicity. So one of the things that you would want to use this data for is to actually calculate a pregnancy rate in a population. The pregnancy rate is the number of pregnancies among females in a given group per 1,000 females in that group. And it's going to be different from a birth rate because it includes all pregnancy outcomes in a population. So hence, it's the sum of live births and fetal deaths and induced abortions over the number of females in that group times 1,000. So we'll give you an example. So pull out your calculators, and I'm going to ask you to calculate the pregnancy rate among Hawaii females ages 18 to 19 in 2022. So we can use the HHGW system to see the number of live births in this group is 342. The number of ITOPs we can pull from the reports here is 128, and the number of fetal deaths is 13. I use the American Community Survey to get the Hawaii population of females ages 18 to 19 to be 14,233. And you can use that to calculate the pregnancy rate in this group, the age-specific pregnancy rate. So I'll give you a quick second to do that. And you should come up with 33.9 pregnancies per 1,000. So if you're looking at the needs of services among pregnant women in this age group, it would be about 33.9 per 1,000 when you're looking at trying to provide services to this group. If you do not want to calculate this, actually pregnancies among females ages 15 to 19 is actually a Healthy People 2010 indicator. And we have actually put that in Hawaii Health Matters for you. And I'll show you this as well. So we do have this same indicator calculated up here in Hawaii Health Matters, and we have the data by state and by county, and then we've taken the 15 to 19 year age group, and we have one calculation that we do for 15 to 17 and one for 18 to 19. So for here, you can see overall in this group, for 15 to 19-year-olds, it's 16.7 per 1,000 females, which puts us lower than the US value, about the same as the prior value. It is a trend that's going down over time. And compared to the Healthy People 2030 target of 31.4, we have exceeded that target. But you can see that obviously we've exceeded among the 15 to 17-year-olds and not quite yet among the 18 to 19-year-olds. So now I'd like to give you an opportunity to work with the data yourself and answer some questions. So please use the reports to answer the following questions. How are fetal deaths and ITOPs rates reported? What is the overall fetal death rate for the state in 2022? And which age groups had the highest fetal death rates? And then please compare the fetal death rates among under 20 weeks of gestation with those 20 plus weeks of gestation. What's the overall ITOPS rate in Hawaii in 2022? And examine those rates by county. Are they the same by county? Which age groups have the highest ITOPS rate? So I'll give you a minute or two to work on those. So the first question is how are fetal deaths and ITOPS rates reported? As we covered, it's rates per 1,000 live births. The next question is, what was the overall fetal death rate for the state of Hawaii in 2022? And to find that, you would come to the fetal death report, and you could scroll up to the first page and you will see that it was 450 fetal deaths and the fetal death rate is 28.2 per 1,000 live births. The next question is which age groups have the highest fetal death rates? So scrolling down to the age, you can see that it's higher among those 40 and older and also among those 18 to 19. But what I will remind you is that those groups also have lower birth rates overall, so lower denominators when we're talking about per 1,000 live births, there are fewer births in those populations. So it's something to keep in mind when you're looking at that data. And then the next one is comparing fetal deaths with under 20 weeks of gestation and over 20 weeks of gestation. So when you look here at the Hawaii data, for example, in 2022, the rate was 13.5 per 1,000 live births for under 20 weeks of gestation, and it's 5.4 for over 20 weeks of gestation. And if you look across the years, it's generally somewhere between, in this case, only in 2021, it was about a half, but otherwise it generally between like a third and a fourth smaller in terms of the 20 plus weeks of gestation, the rates of fetal death. The next questions are running the ITOPS report. So I'm just going to go back here to our ITOPS report that we had opened up previously, and the overall ITOPS rate for Hawaii in 2022 was 1,913 for a rate of 123.5 per 1,000 live births, and asked you to examine the rates by county. And are they the same? No, they're not. You can see they're highest in Maui County and also in Honolulu County. So one thing to know here is that this is not based on the residence of the woman. That data tends to be a little spottier. This is on the location where the ITOPS occurred. And so this actually probably has more to do with locations where facilities that provide ITOPS services than so much the people underneath, whether or not they are receiving them by location. The next thing to take a look at is which age groups have the highest ITOPS rate. And you'll see again that it's by far in the 16 to 17-year-olds. So that's 577.3, and the 18 to 19-year-olds, which is 374.3. But again, I'm going to remind you that these groups have low numbers of total births, right? If you remember when we did that calculation for the pregnancies, there was only 432 births in this age group overall. So when you take the whole thing and you divide it by the number of live births, there were very few live births in this group, which will tend to drive that number up. So just to let you know, just when you're thinking about interpreting that data. We look forward to seeing you next month on August 6th, when we'll be explaining 2 new tools in HHTW to help you when you're building your own reports. We're creating a series of data maps and searchable Excel files to help you find the indicators available in the system.